Hello and welcome to our product evaluation where we will be evaluating the product Biofreeze. So, what is Biofreeze? Biofreeze is a common over-the-counter topical analgesic used to relieve any muscle and joint pain. It is used for temporary relief for conditions such as arthritis, muscle aches, bruises, strains, sprains, as well as back and joint pain. The main active ingredient in Biofreeze is menthol and uses a mechanism called cold therapy or cryotherapy to relieve any pain. Now you may be wondering, how does Biofreeze work? Well, Biofreeze is believed to function based on the pain gate theory, where your nerve receptors detect pain by sending a signal to your spinal cord, which then travels to your brain. Because Biofreeze's menthol acts as a counter-irritant, it inhibits the nerves that transmits pain. You then experience a cooling feeling rather than any pain. The cooling sensation by the menthol has a similar feeling to putting ice, and it helps soothe the area. The cooling effect can reduce blood flow to the affected area, which helps decrease any swelling and inflammation. Some of the benefits of Biofreeze is the versatility and use. Biofreeze is easy to apply and comes in a variety of different forms, such as gels, sprays, roll-ons, creams, and patches, which provides many options for these individuals. Another benefit is that it is a quick pain relief. When Biofreeze is applied, it immediately relieves any pain, and the menthol soothes the pain and distracts from any discomfort. Another reason is that it is non-systemic. Biofreeze is a topical analgesic, meaning it does not enter the bloodstream at all. And once you apply it to any part of your body, it works locally at the site of the pain. Now, Biofreeze is generally well tolerated and safe to use, but some side effects may include skin irritation, allergic contact dermatitis, dry skin, and discoloration. You should avoid putting Biofreeze on any broken skin, sensitive areas, or open wounds. Now, does Biofreeze actually work? Well, we have gathered some articles that have tested how effective Biofreeze is, and we will be going deeper into them. This first article is called The Effects of Biofreeze and Chiropractic Adjustments on Acute Lower Back Pain, a pilot study, co-authored by Zhang, Enix, Snyder, Giggey, and Roger Tepe. They explore the effects of analgesics on lower back pain. This was a randomized control study consisting of 36 participants, 25 males and 11 females, averaging around the age of 34. Participants were randomly assigned to groups, controlled or experimental. The controlled group only received chiropractic treatment, whereas the experimental group received both chiropractic treatment in conjunction with Biofreeze. Subjects were screened to ensure the absence of any heart failure, kidney disease, external medical treatment, or recent surgery. Consent was obtained, and doctors were given specific training to ensure a standard, consistent quality of treatment. The experimental group was given aftercare instructions, however, it is unclear how that aspect could have been controlled. The study sample size is too small to accurately represent a widespread population, and the results could have been better studied if the pain levels were varied. The variability in treatment received could have impacted the results. The researchers did a good job measuring what they were meant to measure and minimizing bias. However, some portions of the results were not examined in depth, leading to the ignorance of confounding variables. The study also did not consider the impact of the Biofreeze on participants' environment, daily stress levels, and the application of aftercare instructions, as they cannot be sure the participants are complying. The article was peer-reviewed, which increases validity by eliminating poor quality, but the sample was more men than women, potentially affecting the results. Observing the effects of Biofreeze on different conditions and individuals helps us take a closer look about how effective it is in treating muscle and joint pain. Moving on to the second study, we will now look at the impacts of topical menthol gels such as Biofreeze on carpal tunnel syndrome. Let's take a look at what this study is, and then we will take a moment to provide our insights. The study is called Acute Effects of Topical Menthol on Chronic Pain in Slaughterhouse Workers with Carpal Tunnel Syndrome, triple-blind randomized placebo-controlled trial. Co-authored by Emil Sundstrup, Marcus Jacobson, Mikhail Brandt, Kenneth J., Juan Carlos Collado, Yuling Wang, and Lars Anderson. Although it is a lengthy title, it does a good job at clearly stating what the study is. All participants received both treatment through a crossover study. The sample consists of 10 people with CTS and chronic pain, with a mean of 8 men and women and a standard deviation of 2. They did not specifically state exactly how many men or women there were. One group received Biofreeze and one received a placebo with a scent of menthol during work, and 48 hours later they switched. A triple-blind study ensures that the treatment given is hidden from participants, experimenters, and the researchers. Proper ethical approval was received before continuing. The participants were informed and consent was obtained. The sample was chosen with specific criteria, but the sampling method wasn't specified. Random assignments was used to decide which participant receives the treatment and the placebo first. Participants were observed and tested on 2 separate days. According to the study article, the placebo and topical menthol gel contained all the same ingredients except for the menthol. The gel was applied according to the surface area and applied 2.5 mils per 500 centimeters squared, applied with light strokes at the end of the lunch break, allowing for 3-hour testing periods. The researchers then measured the pain levels using a scale from 0 to 10 and defined the terms as no pain at all to the worst pain imaginable. The study found that Biofreeze application significantly reduced pain levels in slaughterhouse workers with carpal tunnel syndrome, with a 31% decrease in pain levels. This was observed in Figure 2, which you can see in the slide, through the larger downwards trend after Biofreeze applications. However, the diagnosis of carpal tunnel syndrome was not correctly established and a larger sample was recommended for better results. The study had several limitations, including a small sample size of mostly older individuals, which may not accurately represent the general population. However, there is no conflict of interest, ethical approval, and consent was obtained, and the study is a triple-blind design making sure nobody involved in the experiment or analysis knew what the treatment was received, ensuring no bias. The absence of true control groups may decrease internal validity. The results are clear and concise, with reference and peer review increasing validity through the expert advice, but the generalization of pain perceptors can cloud the results. Although the individual's perception of no pain at all and unimaginable pain can differ, so it is difficult to tell how much pain they're actually in. Speaking as an average reader, a lot of the terms such as level of pain are very generalized and can often cloud the results. Overall, the study's limitations and flaws need to be addressed. This next article is titled A Comparison of Topical Menthol to Ice on Evoked Tetanic and Voluntary Force During Delayed Onset Muscle Soreness by Johar P., Grover V., Top R, and Bem D.G. The study evaluated the effectiveness of 2 treatments for delayed onset muscle soreness: Biofreeze and ice application using a randomized control trial study design. 16 subjects around the age 24 were randomly assigned to each treatment group, ensuring comparable age, weight, height, and physical activity levels, while also increasing the internal validity through the random assignment. According to the study, DOMS symptoms include muscle pain, stiffness, and reduced strength. The exercise protocol was designed to induce DOMS in the non-dominant elbow flexors. Baseline measurements of maximum voluntary contractions and evoked tetanic contractions were taken before the exercise. 2 days after the exercise, when DOMS was expected to be at its peak, participants received their assigned treatment, and the measurements of MVC and evoked tetanic contractions were taken at 3 points in time: 20 minutes, 25 minutes, and 35 minutes after the application of the treatment. The study found that tetanic force was significantly higher with the application of topical menthol analgesic compared to ice. The study found that the topical menthol analgesics were more effective in relieving DOMS symptoms compared to ice, as they had quicker actions within minutes, reducing pain receptors and enhancing muscle function despite ice's longer duration of action. This study has a few limitations. Firstly, the sample size was relatively small, with only 16 subjects in each treatment group, which may limit the generalizability of the findings. Along with this, the subjects in the group were primarily males, which does not equally represent both genders and can skew the results. A potential strength in the ethical aspect is the consent obtained and approval formed by a human investigation committee. Secondly, the study only focuses on DOMS induced by a specific exercise and did not explore the effectiveness of the treatment on other types of muscle injuries. Lastly, the study did not account for long-term effects of the treatment, only measuring immediate outcomes after application. In conclusion, menthol-based analgesics proved more effective than ice in alleviating DOMS-induced pain and increasing evoked tetanic force. This study highlights the need for further to evaluate the effects of analgesics on different types of injuries beyond DOMS. The efficiency and convenience of menthol-based treatment could make them a preferable option in both clinical and athletic settings. Looking at these articles, most of the studies regarding Biofreeze are specific to certain chronic conditions, but there aren't many generalized studies about common muscle or joint pain. As said before, Biofreeze is commonly used as a temporary pain relief, as it is fast-acting and is a great option for individuals who don't want anything systemic or narcotic-based. Based on clinical research, topical menthol seems to be safe to use in treating a range of painful disorders such as neuropathic pain, sports injuries, and musculoskeletal pain. As said before, Biofreeze provides temporary relief, and for individuals who have chronic pain may use it with other chronic pain management, as combining Biofreeze with massage lotions, or oils is beneficial in reducing soreness after treatment and or providing prolonged pain relief after a treatment session. While there has been evidence of benefits of Biofreeze for pain relief, we feel that the product as a whole can help many users that deal with pain, as it is very easy to use and commercially available. With the articles we have gone through, we are aware that they believe Biofreeze is beneficial and there are only small negative risk factors, but it is still vital to further our understanding through ongoing research. Thank you for tuning in, and we will catch you next time.